Hello, it's Catherine with wakeYOURhealthup, and I would just like to talk to you today a little bit about head and neck radiation. So what is it, what to expect, things like that. So I'll just get right into it. Basically, in 2011, in end of October, I was diagnosed with tongue cancer, or squamous cell carcinoma. And what they did to me consisted of a therapy of surgery. I had 2 surgeries. I had radiation, had 35 doses, or basically Monday through Friday, 35 times, or 7 weeks. And then I had 3 chemotherapies, and the first one was actual chemotherapy, and the other 2 were, it's called Erbitux, which is actually an antibody, not necessarily technically a chemotherapy. But today I just want to focus on the radiation. So, with someone like me, who I wasn't a smoker, I was not a drinker, and also I'm very young. So they found that it was related to an HPV virus, which something like 80% of women have, and men also have it. And because of that virus, and several other factors like my immunity had been low, because I feel it was because I was very stressed out about moving into another country and getting a new job. And I'm sure it had to do with maybe not eating the best foods, maybe not taking care of myself as best as I could. So a combination of those things. I think the stress was probably the most important, but all of those things added up, plus I had the virus, and boom, I got cancer. So it looked like a cold sore or canker sore on my tongue, and then over several months it grew fairly big, probably no bigger than a dime. It got to the point where I couldn't eat foods very well, so I went in and had it checked. They did a biopsy. Cancer was diagnosed. Okay, so what to expect? Well, I was lucky. I was diagnosed October 31st, and by November 24th, I had my first surgery. In the first surgery, they removed a piece of my tongue, cut my neck here, and removed some of the lymph nodes. They tested the lymph nodes. They found that yes, indeed, in one of the lymph nodes, the cancer had metastasized. So they went ahead and removed down here just the rest of the lymph nodes. Apparently there's 5 levels. So they removed all my lymph nodes in all 5 levels on the left side. In addition, they removed the salivary gland. After all that, you think you're done. Well, 2 surgeries later, let's see, it was January 2nd, they began the radiation and the chemo, and it was simultaneously. The chemotherapy was started on, I believe, the first day of the radiation. The radiation was Monday through Friday. Like I said, it was 7 weeks long, and if there was a day that was just too difficult, I couldn't do it because I could barely open my mouth, they would just add it to the end. I had to do the full 35 days. And the reason that they do this is to just be sure, because if your cancer is the size of a pea, what they do is they take that pea and then they remove a security region surgically. They remove it on the outside. But it's impossible to say whether all the cancer cells are gone or not, because if you would go to get a PET scan, it would show some of the, it basically shows anywhere in your body that's really metabolizing. And if you just had a surgery, of course there's going to be high metabolism there. So they can't just throw you in and do a test to see, oh, do we get all the cancer, because it's going to show, it's going to look like there's a lot of cancer there, but really it's just metabolism from the surgery and your body trying to recover. So what they do instead is they give you this radiation. And what this radiation does is it basically cooks your tongue. So in my particular, if you have head and neck radiation, you might have a similar way, but in my particular tongue cancer, it was this region here, all around my neck. So basically, think about a piece of chicken. You put a raw piece of chicken, you just bought it, you go home, you put it in the microwave, for example. You put it in for 30 seconds. Let's see what happens. Well, 30 seconds you take it out, and it's no longer cold, but it's a little bit warm, and you don't really see much of a difference. It's still pretty flexible and soft and whatever. It looks like raw chicken. Well, after the first week of radiation, I thought, what are these people talking about? Radiation is nothing. This is easy. You know, I go in, basically the process is they fit you, it's all custom. They custom fit you for this mesh headpiece that holds your head down so you can't move your head, which could be a little bit claustrophobic, but you can breathe. It's just a plastic mesh. You can breathe through it, and actually there's a hole through here. But it's good that it holds you down. They really clamp you in place. In fact, they put some marks on my chest so that they could really line my body up so I wasn't off. Because anything off on my shoulders affects how my neck sits and affects where they're hitting me with the radiation. You put this mouth guard in, which holds your jaw in place and holds your tongue. There's a little cover, so it holds your tongue down so your tongue can't wiggle around. And that's also great because they're going to really put a high dosage of radiation right at your tongue. And then the rest of the area they do they zap you, I call it. They zap, I just say, I got zapped. They zap you with a lower dosage, but they really emphasize the highest dosage right here, and then the rest is not as much. As you put the mouthpiece in, you strap your head down, they ask you if you're okay, and then this machine goes around. It's not very loud. Sometimes you'll see a laser, but it doesn't hurt, it's not painful. It kind of goes around just like the piece of chicken sitting in a microwave. You don't see anything. You might hear a sound like the microwave is working. You don't feel anything. You just sit there, and depending on your radiation plan, I was there for, at the beginning, I believe it was about 15 minutes. Maybe it was 8, I can't remember. And then by the end, I was in there for about 20 to 25 minutes. So the dosage starts out low, and then they work their way up, from what I can remember in my treatment. It might be different with yours. So, okay, so no big deal. First week's over. That was a breeze. I'm thinking, why are people thinking cancer is so tough? Because it just didn't seem that bad. Well, let me tell you, put the chicken back in for another 2, 3, 4, 5 minutes, and you start to see a difference. What do you see? Well, the chicken's no longer soft. After 2 minutes, you start to see the edges get white. The actual makeup of the chicken changes itself. It's a change. So it's becoming cooked, and essentially that's what they do with you, except they target it. So instead of the chicken being soft, it starts on the edges. It starts to get a little bit hard. Well, after several weeks of radiation, things started to change. Well, in the surgery, they definitely removed a salivary gland. So of course, my mouth was a little bit drier, but not really noticeable. You have several salivary glands, so it wasn't something that was like, oh, I have a dry mouth. But after the radiation hits, you start to lose, I believe, about 40% in my case, of my salivary gland function. Because just like the chicken, it starts to cook, it starts to change, and now you don't have the functioning like you did before. After about 2-3 weeks, my mouth was becoming more dry, and because I didn't have the saliva, which is a good, healthy bacteria, some of the bad bacteria started to take over. It gave me mucositis. And what that does is that the bad bacteria takes over, and you begin to get these whitish, yellowish sores all over your mouth. So on my tongue, especially on the tip of my tongue, on the sides of my tongue, on the back, and a little bit even on my gums. Well, definitely on my gums, and a little bit on my cheek. It just takes over your whole mouth. So if you think you have a canker sore, and you can, when you eat tomato sauce or something acidic, like orange juice or something, you're like, oh, it hurts, okay, I'll stay away from those foods. Well, it's not that easy. It's actually much worse than that, because first of all, it starts out with 1, but then in a few days you continue with the radiation. It's Monday through Friday. Next thing you know, you've got 10 in your mouth. And where are you supposed to put the food? Not only do you have these sores all over, but they're a lot more sensitive than the ones you would get normally where you can't eat acidic foods. These sores get so bad that you can barely drink water. In fact, I got to the point I couldn't eat any food. It didn't matter if it was scrambled eggs, if it was the creamiest, softest cheese, or people would say, oh, have yogurt, it's so soft and creamy. No, yogurt killed me. And everything killed my mouth. It was so painful to eat. I mean, I would be crying eating it, and I just couldn't continue because it was too painful. And I have a pretty high tolerance for pain. So, yeah, it was just too much. In fact, the only thing I could really eat, well, I should say drink, was black tea. And I would put some honey in it. But that was it. And it had to be the perfect temperature. If it was too cold, or if it was hot or too warm, I couldn't drink it. So I would make it hot. I'd have to wait about 10 minutes. And then I could drink it when it was just a little bit warm. Please comment below with the top 3 things you'd like to see on the cancer website.